there's a distinct difference between art therapy, which a lot of people know about art therapy or they've heard of it, as opposed to expressive arts therapy. And the primary difference is that art therapy deals with using visual arts, so painting, drawing, sculpture, photography, to help people confront their difficulties, whether they're emotional, psychological, physical. Expressive arts therapy, on the other hand, is all about using the various modalities of the arts. So it might be creative writing. It might be even just how I use my voice, sound, music, drama, theater, as well as visual arts. And so I guess what I could say about it in terms of today is that people are reaching for a new way, a different way, a more relevant way to express themselves. Right? And the arts, I think, in this generation is so beneficial. It is a direct way of using all this social media and everything else that's around to find a new way to express themselves, right? And also it's about finding a deeper meaning to what you're feeling, what you're thinking, and your behaviors, whether they're problem behaviors or just values that you've grown up with, beliefs that you have, right? Another way I can describe it is when you combine expressive arts therapy, because it is another form of psychotherapy, or we utilize psychotherapy to facilitate people in a creative space. And so, not to get too technical about it, but it really is about creating something from nothing sometimes. And one of the terms that we use, or the phrases that we use in expressive arts therapy, is low skill, high sensitivity. And that in itself sort of dissipates anxiety for people because they don't feel as though they have to do something that's representational, right? And what I like about expressive arts therapy is that you can combine it with psychotherapy. As a counselor, I try and really listen actively. I'm ready for whatever the client brings to session. And from there, they might be in a state where they're very agitated, so there's a lot of body movement, or they might be very tense and closed up. And I might implement a kind of movement practice, right? So it's really about being curious to see what the client brings. This new age that we're in, where we have to cover half of our face, makes it that much more difficult. But so then I have to be a little bit more innovative in what I see and how I observe, right, and my communication.